Consultant General Surgeon at the National Hospital of Sri Lanka, Dr. Sajid Ranatunga. Consultant General Surgeon, General Hospital, Shillong, Dr. Asela Jayatillaka.
Good afternoon. So we are going for another virtual presentation. This is on artificial intelligence in trauma research by Dr. Lakshika Tennakor, who is the division of Trauma and Acute Care, Department of Surgery, Stanford University School of Medicine, Stanford, United States of America.
Thank you for giving the opportunity to present Applied Artificial Intelligence in Trauma and Surgery. Here is a concept map I developed to show how interconnections between different kinds of data and the analytical platforms. We see structured and unstructured data. They can be spatially categorical or quantitative structured data, how they are connecting to unstructured data. We have different kinds of variables, different analytic strategies, but still they are interconnected. We have big data, we have small data, very small data. How can we interpret this data using different statistical models or artificial intelligence models? What is artificial intelligence? It is a science between engineering and computational understanding of commonly called intelligent behavior and the creation of artifacts that exhibit such a behavior. Basically, it's a bridge between science and engineering. So there are different methods of this intelligent behavior in artificial intelligence. I would like to discuss a couple of things relevant to this using this diagram. Firstly, the big domain is artificial intelligence, and it can be divided into three domains such as machine learning, natural language processing, can be robotics, and even machine learning can further divide as deep learning. Deep learning is a deep understanding of relational variables in a model, how we can understand exposure and outcome in a medical condition. That's the simplest example. Another way, machine learning is a branch of artificial intelligence and using computer-based systems to make sense out of data. We extract data and we see trends in some of the data, and we can classify data, we can interpret data. And machine learning is helping to investigate more things in depth than we used to do with some of the statistical analysis. There are different types of machine learning approaches. One is supervised learning, or SL. The other one is unsupervised learning, or UL. The other one is reinforced learning, or RL. Using all these different methods, what we are trying to do is we have an exposure and we have a process and we get an outcome. So this is basically an exposure to certain kind of risk factor and what will be the outcome of the disease and results. So we can think in a medical way how we can see this association. Why AI is important? Application of AI could promise improved patient outcomes and better workflow in healthcare providers and in healthcare. And access to large amount of healthcare data, registry data, structured data, unstructured data, we can mine and we can answer some of the unanswered questions in unstructured data. So AI or machine learning methods can apply to understand the meaningfulness of this data. There are different types of AI techniques in medicine. One of the popular ones is artificial neural networks. Artificial neural networks has three layers. One is input layer, hidden layer, and output layer. So this is exactly working like in a real neuron in the central nervous system, same way we are making that one as an artificial model. So let's think about these three layers. Input layer can be our exposure to certain disease. Hidden layer, we don't know what will be the association between this input layer and the output layer. Output layer, as an example, let's say this is outcome. So we know that there are certain risk factors and protective factors are affecting the disease outcome. But there are in between layers, that's hidden layers or variables, they can have an impact for the input and for the output. Using these artificial neural networks, we are trying to understand more in-depth problems in healthcare or in surgery or in medicine. There are AI tools developed for injury predictions. How we can predict an injury, where, when, what type of injury will occur. As an example, motor vehicle crashes input information can affect by weather, traffic conditions, GPS, using or not, and population density. Sometimes having these AI models, we can figure out exactly the injury prediction models, what will happen next. Same way, we can do pre-hospital triage as an example, predict high-risk medical procedures, hemorrhage control, transfusion, needs-based, different kind of techniques based on patient or the trauma information. At the same time, we use some of the sensors for gunshot wounds prediction. One developed here is called ShotSpotter. So that's a sensor will identify prediction of some of the gunshot incidents. And in emergency department, we can predict the injury severity score, the hospital volume, to make decision for physicians, surgeons, and healthcare providers. So these are really important techniques developed in this domain. Another one, in emergency department, when we do any kind of assessment, how we do any kind of radiological reports, how we can interpret these things, images, to make sure accurate diagnosis of these diseases in a faster way using AI models, and we can get into agreement between different physicians, report reading, and we can using AI techniques, sometimes we can get accurate information than different decision making. And disease prognosis, we can predict mortality in ED patients and using these different kinds of AI models. And researchers are working on improving prediction with different data sets, different types of models, how we can understand medical terminology, medical etiology, and management of care. And this is important for patient charting as well. Why? Most of the time we write notes, sometimes it's not clear, another physician will have different sets of notes, I will have different sets of notes for the same patient. How we can standardize this? Using natural language processing or NLP models, will work on unstructured data to give us the meaningful diagnosis with high accuracy and high quality that will help us to manage and treat the patient properly. Sometimes that can reduce the healthcare cost as well. So there are some issues and concerns with AI. One of the things is coming as poor data quality might lead to incorrect AI-drawn conclusions. Various minorities are underrepresented data when we include. Sometimes we see patients who have health insurance, especially in the United States. When you have health insurance, different kinds of health insurance, they go to different sectors. And think about a person who don't have a health insurance. So we might basically miss some of the patients due to disparities of healthcare insurances. Sometimes same way, rural and urban differences. As an example, in Sri Lanka, let's say some urban hospitals, patients are getting more basically support than rural areas. So we won't generalize the outcomes of our diseases to entire Sri Lankan population, because some of the most rural area patients won't get the access to healthcare. So we might lose those things even when we develop AI models or any kind of statistical analysis. So we have bias in the interpretation of our data. And at the same time, there are some ethical issues in AI, how clinicians and how patients are willing to support and willing to give the informed consent to AI type of models, and how basically reliable this information. And there are a lot of ethical issues with the governments, healthcare sectors, doctors. At the same time, educational services are concerned about that as well. So, we know there are issues, but still AI is moving very forward. I just want to give you an example of one of the studies what we are doing. Basically, we are developing a study based on speech features. Why is that? As you know, post-traumatic stress disorder can be diagnosed by 5 different clinicians or psychiatrists in 5 different ways. Differential diagnosis can basically change the entire patient management, because somebody can say this is a depression, someone can say this is PTSD, some can say this is schizophrenia or another psychiatric disorder. So it's very difficult to have these different diagnosis platforms to make the right management plan. So what we are doing here is, we are trying to gather basically audio recordings with institutional review board approval, and we are trying to gather all these clinical interviews and encounters patients had with a psychiatrist, and we have all that audio recordings. And doing all those recordings, we are using a AI model called Random Forest or RF model to identify what are the main speech features in this data set. Sometimes some patients can say their symptoms in a different speech features, different speech styles, and we want to compile all these styles together and how accurately we can diagnose this disease or the PTSD using these speech models. So the goal is to find out speech-based markers for PTSD diagnosis, because it's challenging due to differential diagnosis and self-reporting. So we want to improve the accuracy of PTSD diagnosis. So we do this model called Random Forest using this new algorithm to identify speech features easily to diagnose these patients as PTSD. So there are great valuable outcomes using AI we can modify in this medicine field. So this is one of the examples. I just want to highlight what we are doing right now. We have so many other research going on with AI, but with my time frame, I don't have a lot of time to discuss all that, but if you are interested, please let me know, and I'm happy to provide all that information. Another thing I just want to say, large language models or LLMs, these are very popular methods right now. These are again AI methods, natural language processing, all combined together Here we develop large language models. And one of the most salient example for large language model is, you know that, ChatGPT. So ChatGPT 4 released in November 2022 and developed in OpenAI and San Francisco where we are living. So that has a huge impact on medicine, surgery, or any kind of discipline because people used to make a prompt and they try to find out information using ChatGPT. So we